As you know, a lot of people started returning to the office, some after 18 months yesterday, and it's a phased type thing. And working from home was one thing, returning to the office another thing, and it's a challenge, I think, for people. So we wanted to look a bit more in depth at the emotional side of returning to a life that a lot of people left very abruptly 18 months ago with no notice and no idea of how long it would last. Remember that it was going to be a couple of weeks, then it was going to be Easter, then it was going to be summer, and so on and on. If you have any questions or concerns, do get in touch with us on the show. You can text 51551 or email ray@rte.ie. I'm joined now in studio by Margaret Ford, who's a chartered psychologist and psychotherapist. Good afternoon, Margaret. Thanks for coming in.
Great, thank you.
And in our Cork studio, Professor John Gallagher, Chief Medical Officer with Cognate Health, who also works with the HSE. How are you doing, John?
I'm good, Ray. How are you?
Good to talk to you both. Now, let's see if we can give people some sound advice over the next 10 minutes or so. So Margaret, let's start with you. What sort of feelings do you reckon people are having returning to the office?
Well, I reckon, Ray, that there's quite a variety of ways that people are feeling. Some people are absolutely thrilled to be going back. Do you know what I mean? They can't wait for it. Other people are kind of cautious because they've kind of got used to some of the arrangements, like with kids or with not having to commute and things like that. So they're kind of, maybe looking for a hybrid, a mix of which can I do. And then there are people who are anxious about meeting up with other people and with all the changes that have taken place in the workplace. So I think there's quite a variety of responses really from people about going back.
Okay. John, what advice do you and your company give to the HSE and to employers?
I was reminiscing early on, Ray, about where we were this time last year, and we were just heading back into a winter of discontent. It was just about starting around now. So what a great place to be 1 year later, starting yesterday. And of course, working over the next month on a very phased basis. So we take a simple enough approach, really, in advising employers. Look, and this is all part of allaying the anxiety of people coming back to the workplace, and we must recognise employers are anxious as well about how this is going to work out. So we say there's three things. First of all, prepare your workplace. Secondly, engage with your staff. And thirdly, provide support.
Okay.
So in terms of prepare the workplace, because this is such a key piece, and it's what employers have been doing for the last year, getting ready. It does come down to having a good look around the workplace, eyes wide open at the whole workplace, and then looking for particular pinch points, So you'll be thinking about areas where people might congregate, stuffy areas, poorly ventilated areas, smoking areas, where there's a higher risk if people come back that they might pass it to one another. Secondly, we'd say make sure you've got the hand hygiene, that you've got the provision of masks, the cleaning, the ventilation. All those things are key parts of infection prevention and control. And then thirdly, make sure you've got your COVID response plan in place so that A, staff are aware of the symptoms that you shouldn't come to work with, and B, what should you do if you develop symptoms at work.
Okay. And a lead worker representative, the HSA recommend that all workplaces have this person. So it's a sort of a conduit, a link between the workers and the employer.
It's a key piece. So the second piece, apart from preparing the workplace, of course, is engaging with your workforce about coming back. And that I'd say there are three things again: engage, and engage. It can't do enough engagement, and certainly appointing a lead worker representative from amongst the workers is a very useful way of, as you said, having a conduit and a line of communication open with them.
Yeah, so. Margaret, you were saying three types of people. There's the mix, then there's the people who are glad to be there, and the people who are very anxious. So let's deal with the third group there. Mm-hmm. Anxiety in returning, because over 18 months, it's sort of a lifestyle change, isn't it?
Well,
you nearly forget about how you used to do
it. How you used to be.
Yes, yeah.
And how you used to interact with people.
Yes, exactly,
and, kind of all of that. And
yeah.
even how you are going to, some people are, how am I going to manage to fit it all into my day?
So what advice would you give to those people?
Well, I think first of all, and I think it started to happen a little bit during the pandemic when people got very panicked. One of the things that they realised was that, they couldn't continue to just tell themselves the same story all the time about what was happening, because that kind of produced a lot of anxiety. So one of the things that I very much would focus in on with people is to get them to change the narrative in their head about going back. So, they may have anxieties, but at the same time, there's lots of benefits. Do you know what I mean?
Yes.
There's a huge amount of freedom and everything like that.
And what you would say, and I was reading the thing, is that if you are concentrating and thinking about the positives, there isn't room for negatives in your head. So the positives could be social interaction, for example.
Yeah, that could be one of them.
Yeah.
Because a lot of the time, when people are absolutely, kind of focused on interacting with other people, then you find that there's just a whole lot of nice kind of receptors fire off in the brain,
Yes,
and they feel very good.
Yes. Yeah.
So it's not to deny that people do have those feelings, but to focus more on the good things and the silver linings about going back.
So
that would be very
you're
important.
a big fan of positive psychology, and it is that sort of attitude of gratitude. So
Yeah.
if people just very simply wrote down the positives about returning to work.
Yeah. Well, there's been a huge kind of research into all that simply writing down what's good, writing down 3 good things that you appreciate in your day, 3 good things. So focusing on those. So,
Yes.
there may be things that you regret that aren't there in the workplace that you used to have. There may be perspex everywhere. You know what I mean? You may be behind a mask.
You might be
but-
able to get yourself a barista coffee at 11 o'clock, for example.
Exactly.
You may be able to have the chat with that person who talks to you about the GA or whatever.
Yeah, you'll be able to have a laugh.
Yes.
You'll be able to do, a few different things.
Yes.
So it's to focus on those good things, the small things that happen, because they start creating kind of different types of circuits in the brain that are away from the anxious type of stuff.
The negative stuff.
Yeah.
John, there is a bit of a problem as far as I can see in that there's uncertainty because there are guidelines from the HSA, but there are no rules. So I'm thinking about if you wanted to work from home and your employer decided that you have to be in the office, well, your employer is the person who pays the wages. And then all around vaccination, if you know that a fellow workmate, work colleague isn't vaccinated, what happens then? So there's a number of things that are uncertain.
Yeah, there's good points and great points by Margaret. I look at this, Ray, and especially the talk around vaccination. I think that we've got to where we are by collaboration and cooperation by and large as a population, and that's seen over 90% of the population get vaccinated just in that way alone. So I think that this is best in Europe statistics. I think if we focus on and just keep focusing on collaboration and communication, it's the right way to go. There's plenty of guidance. There will be legislation with regards to an employee's right to ask for remote working. But there's actually plenty of guidance to this. There's a very good remote working protocol produced by the government, and there's a commitment, for example, that 20% of public sector staff are going to be remote working. So they're going to lead by example. But there's plenty of guidance.
So say, for example, I'm just looking at the HSA's guidance here. Employees' responsibilities. Let your employer know if you believe there are reasons why it's not safe for you to be at work.
Yeah.
And I'm thinking to myself, one of those things could be that a person who's working in close proximity to you has told you that they're not vaccinated.
Yeah, look, that's this is something that's come up in a number of radio programmes over the last 24 hours. And of course, there isn't a perfect answer, because of the perfect answer, we'd stop been talking about it. But we are where we are, and we've got over 90% vaccination. The reality is that vaccination, A, protects you against becoming unwell, which is what it's meant to do. And B, it reduces the chance that you're going to pass it on. It doesn't absolutely get rid of the possibility that you're going to get infected. So, regardless whether you're vaccinated or not vaccinated, you can still bring COVID into the workplace. And this is why all of the other stuff about the COVID preparation, the distancing and masks, etc., is just so important. I mean, there are particular workplaces like healthcare, for example, where it's easier to go beyond requesting staff to get the vaccine. In other words, you can look at you can redeploy staff who are not getting it, but it won't apply to most workplaces.
Okay, and. This is a huge, I've said this over and over again, but the whole pandemic is a huge global experiment, and we won't get the results for years to come. But one of the big things will be the comparison between working from home and working in the office. And the thing that I read in a lot of reports early on in the thing was that there was an initial spurt of enthusiasm and productivity, and then it levelled out, and then people were missing things like social interaction.
Well, absolutely, Ray. I mean, there was several problems with working from home. One of them was, people missing, having that support of colleagues. A lot in the area of mentoring was missing. Do you know what I mean? That you would learn informally if you were starting off in a job, and you kind of learn from watching what the other people are doing. All that was missing. And the other thing that kind of tended to happen, and I had a lot of employers asking me to come in and help with teams, that people were overworking.
Right,
because there were no boundaries.
They were fearful of slacking.
Yeah, they were fearful of being seen to slack.
Yeah.
So, people, and because emails were coming in and they were in the home space and people were consulting that,
Yes.
so they were some of the downsides to working from home.
And that's one of the things that Leo Varadkar says, and other people have said, that the boundaries will have to be well drawn, so that people aren't overworking.
Yeah.
And that middle group, I think, is going to be perfect for a lot of people.
I think so.
Hybrid.
I think there will be a hybrid model. I think from practical point of view, I think not everybody is going to be able to go back into the workplace. So I think a lot of places people will be in 2 or 3 days a week. And, there will be, I am hoping that employers will be making flexible arrangements, that will suit people.
The other thing, and both of you are in on this one, because it stipulates in the HSA that employers have to be very cognizant of the mental health of their employees. Now, there would be all the time, but particularly now, because we're hearing about the fallout from the pandemic and all that sort of thing. So how will that look, do you think, John, in workplaces?
Look, I think that, I suppose, there's one thing to remember is that employers are going to have to look after maybe two different workforces, the people who are at home and the people back in the office.
Right.
And both sets of workers have exactly the same entitlements, So in terms of mental health, it's about providing, making sure that staff have got the information available with regards to the resources that they can access. It might be employee assistance programs, psychologists, etc. But the most important thing is that they know they can ask for it and they can put their hands up if they're in trouble. Well, one group to watch out for, and really the way this should work out, is that those people who want to work from home and who it suits in particular are the groups that you want working from home. What you want to avoid here is having a situation whereby people feel compelled one way or the other. It's this middle group that you spoke about, Ray.
Yes.
But I think
So, and that makes sense, John, doesn't it? If somebody wants to do it,
absolutely,
they're more likely to be productive and happy in their work.
It's the same as night duty,
Yes.
It's exactly the same problem with night duty. When people push back or are finding it difficult doing something, they get stressed and it gets more and more difficult. So, ask your staff, okay, how many of you want to work from home? How many days? Engage with them and find out. And those who want to, great, you already got a very happy, productive workforce. And then it's a question of really working with them and building up trust, because so much this revolves around trust, that you're trusting people that they will work as hard at home as they do inside in the office.
But I think it's been proved that most people do, and if not as productive, even more productive.
Correct.
Yeah.
And I think it's with all of this, we've never been here before. The world has never been here before.
And
so we need to be tolerant and cut each other a bit of slack.
And I also think the whole social connection thing John there is mentioning about, not forgetting about the people at home, because there needs to be mechanisms for keeping the communication going with members who are on site and members who aren't on site in a particular team, or you know what I mean. There needs to be
paintballing.
Yeah.
That's what you need, a day paintballing. That'll solve that.
Or that bowl play.
Right. Yeah. John, what an opportunity, What an opportunity here in terms of this, Ray. You just mentioned
changing the world.
We haven't been here before. Yeah. Great opportunity for workers now and for employers to just get to a happy medium for so many people, not having a commute, wasting an hour at the end of each day, being able to be at home with the kids at different times, varying their working times. So they want to work early morning, late afternoon. What a great opportunity.
There you go. Professor John Gallagher, changing the narrative. Margaret Ford. Thanks to you both. Thank you very much. And hopefully that was helpful to people listening at home. Thanks, Margaret. Thanks, John. Thank you.
The Ray D'Arcy Show on RTE Radio 1.